We have Lisa Edwards is our superintendent, and we've got myself and Aaron will be leading the grant making and funding cycle. And we have our commissioners, 5 elected commissioners. They are ultimately the decision makers. The staff will be reviewing the proposals, and the commissioners will also be reviewing all the proposals, and will then be making decisions from there. And we have we also have a larger staff that supports all of our programming and our finances, and to also remember that our facility is available for complimentary free access to all of the residents, to all your organizations, and you can find more information about that on our website. So that's a great benefit to take advantage of. A reminder about the Verdants service area here. You can see the zip codes on the far right, and there's more details about this again in our funding guidelines, which again, you'll find on our website. You'll hear that a few times from me. So jumping in, we want to go right into our, to remind everybody about our funding priority areas. And so the 3 funding priority areas that were decided based on the community health needs assessment last year and then announced at the end of 2022 are mental health, healthcare access, and food security. So those 3 priority areas will help to advance Verdant Health Commission's mission to improve health and well-being of our entire community. That is our goal. Great. And just a reminder that all applicants, whatever the programs that you are proposing to receive funding, that program must be serving the South Snohomish County residents from the map that we showed you earlier, that we prioritize direct program expenses. We are encouraging organizations, if you currently have several, more than 1 priority area, we ask or require that you select 1 priority area. And we're encouraging you to have 1 application per organization. So if you have 2 programs, we're asking that folks submit 1 application for their funding needs. And there's no range for the request amount. So the average award in 2022 was $100,000. We will caution folks that it's going to be a very competitive process this year. We are looking at about $5.9 million in grant award dollars, and we'll be needing to spread that far and wide and deep. And we're expecting a lot of new applicants to come in as well, and we hope so. And so we just keep that in mind when you're looking at your budget needs. And as a reminder, you may be familiar with this for other funders too, but we will not, we're not allowed to award for the benefit of any individual person or for political or religious uses or any fundraising purposes. And again, just to these funds are for 1 year an annual grant award, and the award is not to be used for any capital or equipment requests solely. Okay, so now for our timeline is the grant portal is live. So you can go there now. It opened up November 4th and applications are due on the 2nd. And then we're looking at staff review would be happening in December and commissioner review in January. And we're looking at a decision date at the end of January. This again would be for those applicants that are looking at a contract term of April 1st, 2023 to March 31st, 2024. Great to think about that. Okay. So just to remind you again, more just to have the visual of this timeline, if we'll have some Q&A, that's the middle. Everything in dark green is really, those are actions that are involving the applicants. And in the lighter color will be actions involving, that are primarily internal, led by Verdant staff and commissioners. So we'll have this Q&A period. We'll have the portals is open. We use the system Flux is the name of the grant management portal. And then you submit your application, and we're encouraging folks to submit before the deadline if possible, just to make sure that if you have any glitches that we can help you with those. Then we have that internal review. And then for any new applicants, we'll have the opportunity for you to meet and greet with a couple members of our board. And like I said, the final decisions will be made at the end of January. So continue on. All right, let's dive into it now. So looking at the, getting into the proposal. So first, a few things to mention. As I said earlier, this is an online portal using the Flex system. And there is a number of places where you can receive technical assistance. Many of you may have already been in the Flex system, either through as Verdant as a funder or through other funders. If you need to register your organization, and if you have not yet, if you're not in the system, then you can do so simply with some technical assistance that's provided on our website that has a video to show you how. If you need to add another contact through the portal, many folks have had changes in staff. We also suggest that if you currently do have if your organization is registered, if you could go in and clean up any changes that need to be made. So if you could make any modifications, maybe there's some staff changes, you can add new contacts, and you can also remove some of those that are no longer part of your organization. And then when you're ready to begin your request, you can do so as well. And we have videos, tutorials to show you how to do that. That can all be available on our website.
Jeff has a question about the previous slide.
Yes. Thank you.
Yeah, hi, thanks. Thank you.
Jeff, do you want to unmute?
Yeah, can you hear me now?
We can't hear you.
Okay, it's okay.
Maybe just put it in the chat if the volume's not working.
And just to add, from this point on, it'll be a little more informal. We hope more conversational too, as you ask questions. Okay, someone said they could hear Jeff, but maybe, okay.
I could hear Jeff.
Okay, thank
Oh,
you.
my gosh,
Sorry for any
interesting.
But you're not.
glitches.
Not hearing it on my end. Maybe, what do I need to do? Yeah,
I'll go ahead and just type it
Okay.
into the chat. I think it can be answered
you.
via chat. So
Oh, I can hear you now.
how about now, Leslie? Yeah. Okay. All right, cool. Regarding the public board meetings, and obviously any members of the public are welcome to attend, is that an appropriate forum for people who would be familiar with the proposal to attend and be available for any questions that the commissioners might have, or is that strictly public viewing?
yes, it is. Yeah, it's my understanding that it's public viewing, so it won't be a Q&A opportunity at that time. And I don't know if Maggie, if you want to jump in, as you've been through that before, that process, but my understanding is that folks can come and listen in. And if there's any follow-up questions, then we would ask that separately of you.
Yeah, I can just clarify that in terms of in our public board meetings, there's two opportunities for the public to engage. So there's a public comment section at the beginning of the meeting and a public comment section at the end of the meeting. Otherwise, the rest of the meeting, there's no room or opportunity for people to kind of answer questions or respond. So any feedback from community members, any comments from community members have to be in one of those two public comment sections of the meeting. So unfortunately, there's not that opportunity for kind of like a back and forth discussion during the public board meetings. Any kind of discussion would have to take place out of those meetings with the grants team.
All right, thanks.
Great question. Thank you. Okay. So we mentioned that we've got our online portal. Many of you may be familiar with that. So we're starting with that. And there are 6 main application sections. And so we're going to dive into the program narrative a little bit and the program details and the outcomes today. Organization information, like I mentioned, that should be earlier, pretty straightforward. We'll just ask that you update contacts or make any changes that need to be made. And the budget and any attachments and documents, we're going to have the focus of our next call be around those two areas, those two elements. But today our focus will be around program details and outcomes. And so we'll dive into those now. And what we're doing is we're showing you a snapshot of what it looks like in the portal for those of you that haven't seen that yet. And this will show you that we've got, I think, maybe 6 or 7 questions around the program narrative. And so the initial, as with many applications, is really setting up the need for this program to make it a compelling case why this program is important in your community, why it's what population it's serving, where maybe there haven't been other community partners or other organizations, other services that are providing this need, or if there are, there might be some distinct differences in the community that you're serving that you need to call out. And maybe you're partnering or working with other organizations, and together you're stronger, together you're able to piggyback or serve one another and help better serve the community through that. So here we're asking you to bring in any data that you can that you have available, and I will remind folks that the community health needs assessment that is on the Verdant website has a great resource list of data that was used to learn more about the demographics and the community needs and the health challenges in the Verdant service area. So I highly recommend that you take full advantage of that. And those are fairly up-to-date resources. And so they're available for you. It might save a little search time. And to the extent, you know, some of that data is relevant to you, then that would be useful to apply here. And thank you, Erin's provided that, the funding guidelines for folks to see that. And we can also add a link to the community health needs assessment, so you can have that too. And to the extent too that your program has been existing, which is probably the case for most of you, that you've been running your program for some time, we'd ask you to demonstrate or indicate any success as well as challenges that you've had with your program and how it's been delivering services in the past. That would be useful. For programs that are new, that this is, you're starting up, or maybe you have limited history. It's been maybe just a couple of years. It's been off years for that matter with COVID. It's really simply to explain why you may not have data about the brief history that you do have, that you maybe haven't been able to collect the evaluation data that you have wanted to collect if you are currently existing. And I think, and then looking at, again, how does it directly impact the priority area? That will be very important to show alignment. So we encourage you to read our strategic priorities, the plan, the framework that's on our website. That's front and center on our website too. And take a look at more of the details that are fleshed out there around each priority area. And you can see where the programs that you're offering and that you're requesting support for, how they connect to those priority areas. So that will be very important. Okay, I think we have some questions. So let's go ahead. Someone's raised their hand.
Hi, this is Mateo Hernandez with Communities of Color Coalition.
Communities of Color, go ahead.
Yes, thank you. Can you hear me okay, Leslie? Wonderful. The question that we have in regards to the first question that's on the application, if we're providing any of our own agency data and information beyond the purposes of like reviewing our application, will anything be done with the data that we share with Verdant?
Great. I think I understand that, you know, is this data, will it be publicly shared in any other in any other form or for any other purposes? And the answer is no. I mean, it's, unless, I don't know, I should check with Maggie and see, is this public if someone requests the information, but we don't plan to use that data for any other purposes.
Wonderful. Thank you so much.
I mean, it is a public agency, so if someone should request it, then that would be a different situation, but we would have no, there was no other use. The data that you provide to us is for review purposes only. Does that help to answer your question?
It does. Thank you so much.
Okay. Great. So, so these two questions I will say are the ones that you'll want to spend a good amount of time building, just building the case and making a compelling case too, that this program is serving the community that you've identified that has the most need for your services and how it best fits with the priority area. We are going to ask that you select one primary priority area and one secondary priority area. And excuse me, you don't have to identify a secondary priority area. It's an optional, the secondary. But some, we know many of you may have some overlapping priority areas. You might be working in mental health strategic area, and you may also be looking at access as well. And so we're going to ask you if you are to select one primary area, and it's entirely optional for second. There will not be extra points or any bonus if you identify a second priority area. But we do recognize that some organizations will be crossing over into both. So this is important, this primary priority area, because we'll ask you later for outcomes around the primary priority area. So I think that's it for this section here, these questions. These are just some general tips to throw in, as I find these to be helpful too in my experiences of writing proposals. As a good reminder. Most of you have great experience in writing proposals, but they're always good reminders. So just remember that this is about really telling your story about your organization and to inform us, the reader, the audience. Use each section to really give us a good picture of what your organization's doing, what the project or program is doing. We will be posting our scoring criteria very shortly. We just shared that. We've got the approval from our program committee today, so we'll be able to post that shortly. And you'll want to refer to that scoring criteria as you're writing your proposal and just see, you know, have I in fact provided some data, or have I addressed, did I include all the attachments I'm supposed to include? And just remember to be asking how your program is making a difference, and to be able to illustrate that to us. And then again, use numbers to tell your story whenever possible. It just brings a little bit more objectivity to the review. So that can be helpful. And then if you've had any, you know, major changes, especially with the past couple of years, that you feel like it's useful to explain some changes in the outcomes, feel free to take that opportunity to do so. So great. All right, I'm going to turn to Erin now. It's a little change in voice here, but Erin will provide you some understanding and some background and what we're looking for in the next section around demographics.
Do you want to mute?
All right, so all of you will see this once we post the scoring criteria, but we decided to collect some more quantitative data in the application to be more in line with the priorities that we put in place and talked about in the last Q&A. So the first one is, please estimate the percentage of people served in this program who identify as BIPOC, refugee, or immigrant. We completely understand, especially for a small organization, it is really difficult to collect that information and hold that. So we are really just asking for estimates. It doesn't need to be perfect or exact. So this will just kind of give us an idea, and the commissioners and the staff will all be trained that any scoring that is happening, we want to look at the entire picture of the application, all the information, the data, the data and the narrative should all be taken into account when doing the scoring. So please keep that in mind. And this additional notes section at the bottom is to give any extra context that you would like to provide, especially if you want to say, like, this is, you know, an estimate versus these are hard numbers or anything like that, to give us some more context on that quantitative information. The second place, and sorry, it's blurry, I need to fix that screenshot, but please estimate the percentage of staff, paid employees who work with this program. That is the focus of this application. So basically we wanna get some staff demographics specific to the program that you're applying for. The first section is board and senior leadership, and we have a definition here for senior leadership includes director level and executive staff. And then below is other paid staff. So those sections will be here. I think part of the application, there was a little bug that we're going to fix tomorrow. It wasn't showing this whole question here, so we'll make sure that that is fixed tomorrow. So that's the breakdown here. And same thing, like if you have, some staff obviously might not provide that information. So same thing is just estimates for us here. And just as the demographics we collected above, there's the notes section below to add any additional context as well. So you'll note here that this is all paid staff and doesn't include volunteers. And then the other piece of quantitative data that we're collecting is just the zip code. So of the program that you're applying for, what zip codes do those contain? So select all that apply. And I know some of you might be, working with all the zip codes, so you would select all of them. And some of you might just be very specific, and that's not going to affect, it's not going to give you a higher score to have more versus less. We just want to capture where the program is, where they're serving. I think that's all I had for these ones. Do you want me to pass it back over?
Sure. Great. And then for this question too, is just to be able to give the reader a sense of, again, who will be served. If we recognize that some of the quantitative doesn't really give us a snapshot or a picture. So certainly utilize this space to talk about more of who will be served, and also what your outreach approach is to reaching participants for your program. So what are some of your strategies?
Really quick.
Sorry, I just saw Paula had a great question in the chat. If we are listing staff and have had the program for years, what time period are we using? It's a really great question. So I guess if it's an existing program, maybe, and I can verify this, I think, the snapshot of what it looks like right now, but that might be difficult if it's a program that you're starting. So you would maybe put that, what you anticipate, and that would be difficult. So really in the notes, you could either put zeros for all of it if it's all new staff that would be hired, or a snapshot of what it looks like now if it's an existing program, and just giving us that context in the notes below. Does that answer your question, Paula? Okay, perfect. Thank you.
Okay. Okay, great. All right, we can go to the next slide. And this is now moving to outcomes. And again, I'm sure many of you have seen this question from other funders, so it'll be fairly similar that, we're looking for you to identify what outcomes you anticipate out of the, if this program were to be funded, what you hope it will accomplish in a year's period of time. And we do recognize that, outcomes sometimes will take many years to be able to show what kind of progress or impact it's had in the community. So we'll be looking for more of the short-term outcomes, or maybe it's a benchmark or a milestone to get there. And then what is your approach or your strategy to achieve those outcomes and to be able to measure those? And so we are asking that at least one of the outcomes indicates the number of individuals served, more of an output. So we have a sense of, is it 5, is it 20, and to be as realistic about this as possible. I'll go to some additional slides here that I wanted to help, again, really provide more of an understanding for some of you that may be new to this type of question. So if we can go to the next slide. So around outcome measurement, it's to just remind us that this is about the results of services or programs. It's not about outputs. It's, in short, we're just asking, did what we say was going to happen actually happen? And we recognize that this is a long-term process. And so it does take some time. And we're looking at, what after 1 year, what step forward, what kind of progress are you looking to see? And then, and to note also, and some of you may have experiences, and you might have some great examples to share with us too, but we see it as valuable to all stakeholders this step of identifying your outcomes. And it's really effective when it's participatory, when it involves the community or community leaders, could be advisory groups or working groups of community members. If they could have some stake, some input to weigh in, so that can help it be more effective than some of us that might be, at a desk or behind the scenes. We think that often does show greater impact. And then we are also noting that we recognize this is not any academic evaluation. We're not looking for that. It's hard to make causation with this. I know that my experience of, tutoring a student for many years, he did well at school. It's not because I was tutoring him. There could have been 5 other reasons easily, or 500 why he's doing well. So we're not looking at causation here, but again, just seeing what you're learning about your activities and if they're effective. So we'll move to the next slide. And again, this is just a slide. It's more, I won't read through all of this because I want to open up time for questions, but I'm providing this. We want to provide this so that you can refer back to it. It gives you examples of outputs versus outcomes. And I've also provided just an example of this is a source that I had come across in putting this together from the Hunger Center around outcomes for food security programs. So providing that as an example, and it can give you some ideas. Okay, next slide. Great. Now this is scary, the slide. It scares me, at least, I will admit. This is to say that many of you may have heard of logic models, and it by no means is anything that we're asking that you do this, but it might be one way to think about, what are the inputs, what are the activities, and then what are the different short-term, medium outcomes, longer-term outcomes. So this is it can be messy. Ultimately, it can be effective. The slide I really like is the one that follows. So let's take a look at that one. It's a little bit more appealing to the eyes. Maybe I just like the color. I like that it seems more straightforward. This is probably better, as a communication tool. But again, if we look at the outputs, how many, in this case, how many gardens were built? How many workshops were offered? That's going to be one of the outputs that you'll have of the 3. And then we're probably looking at the short-term outcomes, maybe midterm outcomes, depending if your program is a year-long program. There might be midterm outcomes in that. And so at this point, we're not expecting that we're going to see long-term outcomes after a year. I think we're realistic to know that. But again, this is just to give us some familiarity of, hopefully it's a useful tool to you. And if you have something else that you're using that works great, fantastic. We welcome that, but I'm just providing this to give you as an idea of how you can begin to think of your outcomes and that they're separate from outputs. Okay, next slide. Thank you, Erin, for providing these. And if you want more on outcomes, I didn't want to provide too many resources, but I thought the Council on Nonprofits has a fairly good toolbox that you can peruse and just get some ideas. You can also search for your priority area, as I did. I put in food security and outcome measurement. And so that's how I came up with the Hunger Center toolkit. And then, and also to be mindful that, we recognize, we only have so much time to work on the proposal, and there's a lot of other content that you'll be bringing into it. And this is a busy time of year, and you have other applications that you're submitting. So, be realistic of what you can provide, but I thought better to include the resources here if you need them, and or just to refer to them. So great. Next slide. I think this is wrapping up just some additional tips for you, and that just remember your audience. Do remember that it's helpful to be concise, not to go make sure you make your point, and then if it seems pretty clear, then there's not really a need to expand on that. At times, it's useful to have examples if you think it's something a reviewer may not understand, or if it may seem too abstract, the activity. Then also assume that the reviewers are just learning about your organizations, even if you have applied before. I mean, Erin and I are new, so we'll be reviewing them, and so we may not be familiar with your program, and so you'll want to present that to in the application as if someone's reading it for the first time. And then just tell your story clearly. That's been said a few times. And if you can, submit your application early if possible. Okay, next slide. Great. And this is just a reminder to, was shared in our November 1st, and it's November 1st session. It's also in the funding guidelines. And this is the weighted scale across the 4 areas around community impact and how diversity, equity, inclusion practices are embedded into your program. So that's 40% of the score. And looking at the community needs, how that's been demonstrated and what the opportunity is, that's 25%. And then your implementation plan, 20%, and desired outcomes up to 15%. Okay. And there's more tutorials, as we mentioned, and we'll have another technical assistance session on November 15th. And again, we'll be updating the website with frequently asked questions. And I think from there, we want to open it up to questions this time.
I'm gonna do the audio over here since we're having an issue.
So everyone can feel free to unmute and ask your questions, and maybe Leslie, you want to come over here so that they can hear you for the answers.
It appears my laptop volume wasn't working, so I'm sitting aside Aaron to see if we can hear your questions and answer them. Ask away, raise your hand. You can include it in chat. Was this helpful? Do you have any examples you want to share with others?
I have a question. Is the application viewable without going in to do the application?
We currently have all the questions in the funding guidelines. The first PDF that I had in there, it doesn't show the character limits or anything. So if it would be more useful to have an actual snapshot of what the application looks like, I can certainly create that and have that added. But I just put that link in there again. It just has listed out all the questions.
It would be great if you could. I'm going to have to gather a group to try to come up with the collective answers, and it'd be nice to have that. So
absolutely, yeah, I've done that in the past. I'll do like a shareable Google Doc, and then you can just save a copy of it and start it for your org.
Thank you.
Yeah, absolutely. We have a question that came in the chat. You want to?
Yeah, what if the program serves both people in the hospital district, serves both individuals in the hospital district and others outside of the district? And it doesn't need to be exclusively, and Maggie, jump in to correct me, please. But my understanding is that a majority would need to be in the hospital district. Yeah, that's correct. Thank you. Okay.
Hi, guys. I have a question. Ken from Boys and Girls Club. Are you looking for the applications to be weighted toward BIPOC? I know you want to know that information for the kids who we're serving. We serve a lot of different communities, and so in South County, you've got communities that are heavy in that category and those that are not. And I have a club that it represents both of those. Is there a preference that the commission is looking for?
That's great. It's a great question. And we are not looking for, we want you to put forth proposals that are serving the communities that you see are in need in your community, that fit with your identified community. And we will be looking collectively across all the proposals. So in the ultimate decision time, how the recommendations are supporting all of the Verdant service area and the diversity of that population. So we'll be looking at, based on demographics, just how well we're, all of the program requests that have come in and those that are being recommended, how well it's serving those needs. But we're not asking any organizations to make changes or to put, particular emphasis in populations that they might not otherwise. So or that may not be possible, just given where they live. There might be other demographics or other needs that are requiring services. Great. You mentioned only one application from an organization. If we apply in November cycle, can we apply again in the May cycle? It's a good question. I think that you probably could. I'm going to turn to Maggie again because I'm still familiarizing myself with some of the past when there was a quarterly cycle. I don't know if you can have.
Yeah, so I mean, so I think the answer is, I mean, in theory, yes. We're a public agency. You can apply for funding. For sure, if you applied in the fall and were not awarded something, you could apply again in the spring. That being said, I think that, again, it's not required, but it's encouraged to apply with one application. But we also know that there are times where there's a specific opportunity that emerges that you want to respond to. So it wouldn't disqualify you from applying. But that being said, there is a preference for organizations applying for kind of one cohesive project application.
Back to Ken's question, we will be posting the scorecard basically, so that we just got approval from the program committee this morning. So I would really recommend looking at that in terms of what our priorities are around diversity, equity, and inclusion, because that is a big piece of the weighting.
Yeah, thanks, Maggie, on that response earlier. Other questions? Are folks more confused? Yes.
Hi, this is Michael with Project Access Northwest. I just had a question regarding the budget and the personnel section. Did I see correctly where you want us to list out the employees and what their annual salary is? Did I see that?
I don't think so. Not that I reckon. I think we said to use the comment field to share FTEs. I don't think we had said salary, but it would just be helpful to know, will there be, two staff working on a project or 5? So
yeah, because in the budget, the help document you guys shared, it's under optional comments. It says like rescue center manager, and then there's a dollar figure next to it. So I was just wondering if you want us to actually include their salary. It's on page 25 of the budget PDF.
Oh, the budget PDF in the
help guide.
In the help guide. Okay. That could be from, okay, we'll have to take a look at that and see. Not to my knowledge, and I don't know if, Maggie, if you want to weigh in, that might be something from, it may be just a full dollar amount that shows, and it could list out, this includes the following staff, but one aggregate dollar amount.
My understanding is that's optional. So we do have some partners who choose to list out that information. And then, so some people want to kind of provide that greater clarity, but it is not required. So what you decide, what level of detail you decide to provide is optional.
Okay, great. Thank you.
Yeah, personnel costs.
Funding guidelines on the website, some different funding, budget guidelines. Yeah. Okay. Other questions? Have folks gotten started yet? You don't have to answer that, but if you have, and you have more technical questions too, specific to even Flex, you can let us know. We have a sort of catch-all inbox that Erin and I will be managing, and that is at grants@verdanthealth.org, and that's you'll find that throughout the website as well. So that way we'll be able to respond timely if you have any questions. Yeah. If you applied and were awarded, is that a new question that just came in? Yeah. And were awarded food in January, could you apply for, oh, I see, for food security in January, could you apply for healthcare access in May? Certainly. There may be, either where you're seeing complementary priorities that and as you get deeper into one with the community, you might learn of other priority areas that your organization can support. So certainly that would work. Yeah. Other questions? We can give it a couple more minutes. If folks don't have any, then we can have free extra time for you to finish your lunch, or you can dive into that grant portal and take a look yourself to see if it's making sense, if it's coming together. Again, we'll have one more call next Tuesday, and that focus will be on the budget and on attachments, but we'll also, or any budgetary information. So if you have a finance person that's working on, for some of you that are fortunate to have a finance person working on the proposal, feel free to invite them to the call. And we'll also have it open for any other questions that you have, regardless of, if it's related to other areas of the proposal, to the application. That's great too, as you start to get deeper into it. And I think that's it, I guess. I want to just give a big shout out to Maggie Konstansky. Maggie has been amazing in helping us in our own onboarding, and has been very supportive of all the grantees that are currently in the portfolio, and helping with much of the infrastructure that you see here today. So it makes it very easy for Aaron and I to continue this on. Maggie's last day is today, but hopefully Maggie will not be a stranger to Verdant. We will, you'll see Maggie in the community, and we look forward to carrying on much of the good resources that she's left us. So many thanks to Maggie. But basically not to send emails to Maggie, right, Maggie? You may not hear from her.
Yeah, thank you, Leslie. And it's been a joy to work with all of you. I look forward to continuing to watch all the amazing work you all do. And I think we've just been encouraging people to use the grants at verdanthealth.org if you need to contact someone or have questions, because that will be the best email to reach to ensure continuity. But thank you, everyone.
Thank you, Maggie. Yes, we all need Maggies in our world to help us through this. So I think at this point, any other questions come up? Did we see any? Covered all the chats? Okay. So hopefully we will, we want to be here for you. Our goal is to really continue with transparency, to, build in equity, every opportunity that we can, through sharing the scoring with you. Use those comment fields if you need to explain something that's not entirely clear the way the questions are asked. So we will be doing the best we can on our end to support you. And again, use grants at verdanthealth.org.
Yeah, and we'll send out an email to those that joined this with a link to the application template, and we'll make sure that's made available to all the other applicants as well.
Great.
Right.
Thank you. Signing off.
Thank you.
All right. Have a fine afternoon. Thank you.
Thank you.